Most of the questions you would get in the head and neck anatomy are going to be related with nerves, especially these two, the fifth and the seventh. So let's start with the trigeminal, and then we will come back to these questions and try to answer after, looking at the distribution of the trigeminal. So as we know from the neuroanatomy which we were doing, trigeminal nerve is a mixed nerve. It has a sensory and motor component attached to the pons. So the superior part of the pons, you can see a motor and a sensory part of the trigeminal. The sensory part is bigger, the motor part is smaller. It has three divisions which arise from the trigeminal ganglion. So this motor and sensory component of the trigeminal nerve, it is going to pass into the middle cranial fossa, and in the middle cranial fossa you have this ganglion which is called the trigeminal ganglion or the Gisserian ganglion. So if you hear Gisserian ganglion, semilunar ganglion or trigeminal ganglion, these are all the same things. So it's just the name of the trigeminal ganglion. So the motor and the sensory rootlet are going to move towards the trigeminal ganglion, and from trigeminal ganglion there are three divisions of the nerves which are going to come out: ophthalmic, maxillary and mandibular. So you should imagine these three nerves similar to what you see in the in terms of any sensory tracts. So you know that the first order neurons are present, the cell bodies are present outside the central nervous system. So for dorsal root ganglia, for example, is present outside the spinal cord. Similarly, trigeminal ganglion is a ganglion which is outside the central nervous system. It has the first order neurons for the sensory nerves. The three peripheral divisions are ophthalmic, maxillary and mandibular, and the central part is going into the pons, where it is going to divide into three nuclei: the principal sensory, mesencephalic and the spinal trigeminal nucleus, which we have dealt in the neuroanatomy. Now what you see here is that ophthalmic nerve supplies the eye and the forehead up to the vertex. Maxillary nerve is going to supply the cheek and the upper teeth, while the mandibular nerve is going to supply the mandible and the lower teeth. So this is the distribution: forehead and the eye, ophthalmic, cheek, side of the nose and the upper teeth, maxillary, mandible, lower teeth. This part is all supplied by mandibular division. But the motor rootlet, which was coming with the sensory rootlet from the pons, is not going to enter into the trigeminal ganglion. It is going to pass below the trigeminal ganglion and will join the mandibular division of the trigeminal to exit out from the middle cranial fossa. Now, ophthalmic nerve is going to go towards the orbit. So it is going to pass through the superior orbital fissure. So from trigeminal ganglion, the ophthalmic nerve is going to come out and it is going to go towards the superior orbital fissure and enter into the orbit. The maxillary nerve is going to get into the foramen rotundum and it is going to enter into the pterygopalatine fossa. So from the middle cranial fossa, there is trigeminal ganglion. It is going to give rise to the ophthalmic nerve. Ophthalmic nerve, after passing from the lateral wall of the cavernous sinus, it will go into the superior orbital fissure and enter into the orbit. The maxillary nerve is also going to pass through the lateral wall of the cavernous sinus and then pass through the foramen rotundum to enter pterygopalatine fossa. The mandibular division of trigeminal is going to go down along with the motor rootlet of the trigeminal, and it is going to pass through the foramen. Who's this? Through the foramen. So the mandibular division is going to pass along with the motor rootlet of the trigeminal. So the sensory part of the mandibular and the motor rootlet of trigeminal will join together in the middle cranial fossa. It would pass through foramen ovale and enter into the infratemporal fossa. Okay, clear? So there are three nerves: ophthalmic, maxillary, and mandibular. Ophthalmic is passing through the superior orbital fissure, entering into the orbit. The maxillary is passing through the foramen rotundum, entering into the pterygopalatine fossa. And then foramen ovale, the mandibular division is passing through foramen ovale, entering into the infratemporal fossa. So the motor component of the trigeminal is going to supply the muscles of mastication. The fifth nerve also serves as a conduit for the parasympathetic function of the third cranial nerve, the seventh cranial nerve, and the ninth cranial nerve. We also said, if you remember in the neuroscience, that there are 4 parasympathetic ganglion. One is the ciliary ganglion, which is present in the orbit. There is a pterygopalatine ganglion, which is present in the pterygopalatine fossa, and there is a submandibular and submandibular ganglion, which is present in the submandibular, near the submandibular gland, and there is the otic ganglion, which is present in the infratemporal fossa. So there are 4 parasympathetic ganglions. One is the ciliary, which is in the orbit, related with the third nerve. There is pterygopalatine ganglion, which is present in the pterygopalatine fossa, related with the facial. There is a submandibular ganglion close to the submandibular gland, below the mandible, that is also related to the facial. And there is an otic ganglion, which is related with the parasympathetic function of the ninth cranial nerve, and it is going to supply the parotid gland. So let's see these divisions. So this is the area of supply of V1, which is the ophthalmic. This is the area of supply of V2, which is the maxillary. And this is the area of supply of V3, which is the mandibular division of trigeminal. So this is the skin distribution of the ophthalmic. You can see that this is the bridge of the nose, the upper eyelid, and the eye, and the forehead by the ophthalmic. Maxillary is supplying the temple, lower eyelid, side of the nose, upper lip, while the mandibular is supplying the lower lip, chin, side of the cheek, on the in front of the ear. So this is the area supplied by the mandibular division of trigeminal. Now you can see the Gisserian ganglion here. This is the Gisserian ganglion. You can see the ophthalmic division passing through the supraorbital fissure into the orbit. The maxillary division is passing into the foramen rotundum. It would continue into the pterygopalatine fossa. And then you can see the mandibular division passing through the foramen ovale into the infratemporal fossa. So this is the middle cranial fossa. You are seeing this is the trigeminal ganglion, and this is where the trigeminal nerve is coming out from the pons. The 4 ganglions. The ciliary ganglion is attached to one of the branches of the ophthalmic nerve, which is called the nasociliary nerve. So ophthalmic division gives 3 branches. One is the frontal, nasociliary, and lacrimal. So the ciliary ganglion is attached to the nasociliary nerve in the orbit. So you can see V1 is a conduit for the parasympathetic supply to the preganglionic parasympathetic supply to the ciliary ganglion. Then you can see that the pterygopalatine ganglion, which is present in the pterygopalatine fossa, is attached to the maxillary nerve. So maxillary nerve acts as a conduit for the parasympathetic preganglionic supply to the pterygopalatine ganglion. Then you can see the otic ganglion, which is present in the infratemporal fossa. This is attached to a branch of the mandibular division of trigeminal, which is called the auriculotemporal nerve. So auriculotemporal nerve lodges this ganglion, which is called the otic ganglion. It's a preganglionic supply from the glossopharyngeal nerve, which is the ninth cranial nerve. We'll tell you how the preganglionic supply comes to this nerve and then goes to the otic ganglion. And then you can see the final ganglion, which is the submandibular ganglion. It is attached to a branch of the trigeminal, mandibular division of trigeminal, which is called the lingual nerve. So the lingual nerve lodges this ganglion, which is called the submandibular ganglion. So ciliary ganglion is attached to a ganglion, to a branch of the ophthalmic division, which is the nasociliary. Pterygopalatine ganglion is attached to the maxillary nerve. It is hanging with the maxillary nerve. The aortic ganglion, which is present in the infratemporal fossa, it is attached to a branch of the mandibular division of trigeminal, which is called the auriculotemporal. And the lingual nerve, which is also a branch of mandibular division of trigeminal, lodges the fourth ganglion, which is the submandibular ganglion. It's functionally a part of the facial nerve. So ophthalmic division, we'll start with ophthalmic, then we'll go to maxillary and then the mandibular. So ophthalmic division, as we said, it comes out from the trigeminal ganglion, passes into the supraorbital fissure, and as it passes into the supraorbital fissure to enter into the orbit, it is going to divide into its three branches: frontal, nasociliary, and lacrimal. We'll talk about each one of them in detail, but it is going to divide into frontal, nasociliary, and lacrimal. Area of supply, it is going to supply the frontal, sphenoidal, ethmoidal, paranasal sinuses. So if you have a frontal headache here, or you have the headache on the side of the nose, these are the ethmoidal air sinuses, and this is the frontal air sinus. They are all supplied by the ophthalmic division of trigeminal. General sensations to the nasal cavity, cornea, and conjunctiva. So the cornea and conjunctiva are also supplied by the ophthalmic division of trigeminal. We will come to specific nerves which are going to supply the cornea and conjunctiva and other places. It supplies the upper eyelid, it supplies the tip of the nose, so the bridge and the tip of the nose, forehead and scalp, and lodges the ciliary ganglion, which is the parasympathetic nerve supply for the third nerve. It's a functional part of the third nerve. So as I said, it is going to enter into the orbit through the supraorbital fissure, divide into its three branches. This is the frontal nerve, this is the lacrimal nerve, and this is the nasociliary. The frontal nerve is going to pass near the roof of the orbit. So just along the superior rectus muscle, it is going to pass over the roof, and it is going to come out near the orbital margin, dividing into supraorbital and supratrochlear nerves. These supraorbital and supratrochlear nerves are going to supply the upper eyelid, the forehead, and the skin up of the scalp up to the vertex. They are also going to supply the frontal air sinus. So frontal air sinus, forehead, upper eyelid, skin of the scalp is all supplied by the supraorbital and the supratrochlear nerve, which are the branches of the frontal nerve. The nasociliary nerve, which you see here, is going to give a branch to the ciliary ganglion. So ciliary ganglion is attached with the nasociliary. It moves towards the medial side of the orbit. So it moves towards the medial wall of the orbit, and in the medial wall of the orbit, it is going to give posterior ethmoidal nerve. This posterior ethmoidal nerve is going to pierce the medial wall of the orbit and supply the sphenoidal air sinus. Then it is going to give the anterior ethmoidal nerve, which is this one. And this anterior ethmoidal nerve is going to also pierce the medial wall of the orbit, and then it will pass through the cribriform plate of the frontal bone into the nose. So the anterior ethmoidal nerve not only is going to supply it is going to pass from the medial wall of the orbit, pass through the cribriform plate of the ethmoid into the nose, and that just at the junction of the nasal bone with the septum, it is going to come out and supply the skin over the bridge of the nose and the tip of the nose as the external nasal nerve. So anterior ethmoidal is going to supply the anterior part of the nose, inner part of the nose. It is going to supply the bridge of the nose, also ethmoidal air sinuses. are also going to be supplied by the anterior ethmoidal nerve, which you see here. So this is the posterior, this is the anterior, this is the ciliary ganglion. Also, nasociliary is going to give rise to the long ciliary nerves. These long ciliary nerves will enter into the eyeball and supply the cornea and the conjunctiva. So the sensory supply to the cornea and the conjunctiva are going to come out from the branches of the nasociliary through the long ciliary nerves, which are these. So we talked about the frontal nerve, which went near the roof of the orbit, divided into supraorbital and supratrochlear. Nasociliary moves towards the medial wall of the orbit. It gives ganglionic branches to the ciliary ganglion, posterior ethmoidal branch to the sphenoidal, air sinus, anterior ethmoidal branch, which will pass through the medial wall of the orbit into the cranium, and then pass through the cribriform plate into the nose to supply the anterior aspect of the inner nose, as well as the tip of the nose, the skin of the nose. And then the nasociliary is going to continue and come out as the infratrochlear nerve. So the medial side of the eye, it is going to be supplied by the branch of the nasociliary, which is called the infratrochlear nerve. So these are the four branches of nasociliary. The long ciliary nerve is going to enter into the eyeball, and it is going to supply the cornea and conjunctiva. So you have long ciliary, anterior and posterior ethmoidal branches, the infratrochlear nerve, and the ganglionic branches to the ciliary ganglion. These are the branches of nasociliary nerve. Then you have this nerve, which is the lacrimal nerve, and this lacrimal nerve is going to go along the lateral wall of the orbit, supply the lacrimal gland, and then it is going to come out and supply the lateral side of the upper eyelid. This nerve is going to be joined by a branch of maxillary, which is bringing the parasympathetic supply from the pterygopalatine ganglion to the lacrimal gland. But lacrimal nerve itself is a sensory nerve, but in the orbit it is going to be joined by a branch of maxillary, which is going to bring the parasympathetic supply to the lacrimal gland. But as such, you see that ophthalmic division of trigeminal is purely sensory nerve. It has three major branches: frontal, lacrimal, and nasociliary. Frontal has two parts, supraorbital and supratrochlear. Nasociliary has 5 branches: ganglionic, posterior ethmoidal, anterior ethmoidal, long ciliary, infratrochlear branches. These are the branches of nasociliary. And then you have the lacrimal nerve, which supplies the lacrimal gland, as well as it is going to exit out from the orbit, supply the lateral side of the upper eyelid. So if we see this is the supraorbital fissure. You can see the frontal nerve here dividing into supraorbital and supratrochlear. So it is running on the roof of the orbit between the eyeball and the roof of the orbit. Here we have taken out the roof of the orbit. So you are looking at the frontal nerve and the two parts of the frontal nerve, the frontal and the supratrochlear. Here you can see the lateral part. In the lateral part, this is the lacrimal nerve going to the lacrimal gland. This one is the nasociliary moving towards the medial wall. This is the nasociliary passing over the optic nerve. This is the optic nerve. Nasociliary usually crosses the optic nerve to move towards the medial wall of the orbit. Here you can see the two branches of the nasociliary, the posterior ethmoidal and the anterior ethmoidal nerve. This is the long ciliary nerve going into the eyeball. So this is the long ciliary nerve from the nasociliary going into the eyeball, and then it is going to supply the cornea and the conjunctiva. This is the supraorbital and supratrochlear, and this is the area from where the infratrochlear nerve is going to come out. So this area is supplied by the frontal nerve, this area is supplied by nasociliary, and this area is going to be supplied by lacrimal. This is the area of supply of the ophthalmic division of trigeminal, and this is the area of the nose which is supplied by the anterior ethmoidal nerve. The posterior part is going to be supplied by the maxillary. But this anterior part of the nose is supplied by the ophthalmic division of trigeminal, especially by the anterior ethmoidal nerve. Now we are coming to the maxillary division of trigeminal. It's a purely sensory nerve. Maxillary air sinus is from where the referred pain from the maxillary nerve can come. General sensations not smelled to the nasal cavity. So most of the nasal cavity is supplied by, the general sensations are supplied by maxillary nerve. Lower eyelid, skin of the cheek, upper lip, maxillary upper teeth and gums lodges the pterygopalatine ganglion, which is part of the seventh cranial nerve. We said that maxillary nerve is going to come out from the trigeminal ganglion, and then it is going to pass through the foramen rotundum. Foramen rotundum will take the maxillary nerve to a fossa which is called the pterygopalatine fossa. If you look at the pterygopalatine fossa, the communications of the pterygopalatine fossa you should know. If you go in front of the pterygopalatine fossa, there is inferior orbital fissure which takes it to the orbit. If you go laterally, you are getting into the infratemporal fossa. If you go medially, you are entering into the nose. If you are going down, you are entering into the palate. And if you are going back, you are entering into the pharynx. So these are the communications of the pterygopalatine fossa. What you need to keep in mind, pterygopalatine fossa, if you're going in front, you're passing through the inferior orbital fissure into the orbit. If you are going laterally, you are passing through the pterygopalatine fissure into the infratemporal fossa. If you are going medially, you are passing through the sphenopalatine foramen into the nose. If you are going down, you are going passing through the greater and the lesser palatine canals into the palate, the hard and the soft palate. If you are going back, you are going to pass through the palatovaginal and palatopharyngeal canals towards the pharynx. So pharynx, palate, infratemporal fossa, nose and orbit. These are the communications of the pterygopalatine fossa. So all these branches of maxillary will follow these communications. But if you look at the maxillary divisions, the course is that it is going to come out from the foramen rotundum, enter into pterygopalatine fossa, and then it moves straight. It passes through the infraorbital fissure as the infraorbital nerve, running on the floor of the orbit, and then exiting out from the infraorbital foramen here. So it's almost straight nerve. It is passing from the middle cranial fossa, passing through the foramen rotundum, entering into the pterygopalatine fossa, and then passing forward through the infraorbital fissure on the floor of the orbit in the infraorbital groove to run out and come out as the infraorbital nerve. So the terminal branch of the maxillary nerve is the infraorbital nerve which comes out on the cheek. Now let's see this nerve. This is the nerve which you are seeing. This is the trigeminal ganglion. This is the foramen rotunda. It enters into the pterygopalatine fossa, passes through the infraorbital fissure into the orbit, runs into the floor of the orbit, and then comes out through the infraorbital foramen as the infraorbital nerve. Clear? Everybody has this course in mind? Yes. Passing from middle cranial fossa through infraorbital fissure into the orbit, running on the floor of the orbit in the infraorbital groove. Now, during its course, you can see these blue fibers. Can you see these blue fibers? And you can also see these green fibers. The blue fibers are the parasympathetic fibers. The parasympathetic fibers are the fibers from the facial nerve. So when the facial nerve is present in the ear, inside the ear, we will talk about the facial nerve. So facial nerve has a course inside the middle ear. So when it is present in the middle ear, it is going to give rise to a nerve which is called greater petrosal nerve. And this greater petrosal nerve will pierce the petrous temporal bone and will come out into the middle cranial fossa, pass through the foramen lacerum and reach the pterygopalatine fossa. In the pterygopalatine fossa, this greater petrosal nerve is going to join the pterygopalatine ganglion. And the pterygopalatine ganglion is going to give its branches through the maxillary, and the maxillary is going to supply the lacrimal gland in the orbit. But we'll see now the branches of maxillary first. What are the branches of maxillary? Maxillary does not give any branch in the middle cranial fossa. The first branch which the maxillary is going to give, it is going to be in the pterygopalatine fossa. So in the pterygopalatine fossa, it is going to give branches. Now, what branches it is going to give in the pterygopalatine fossa? We told you there are communications of the pterygopalatine fossa. To the nose, so there would be nasal branches going through the sphenopalatine foramen into the nose. So posterior part of the nose, lateral and medial part of the nose are all supplied, sensory supplied through the maxillary. So there are posterior lateral and posterior medial nasal branches from the maxillary which are going to the nose. There is communication with the hard and soft palate. So there is greater palatine and lesser palatine nerves which will pass through greater palatine and lesser palatine foramens to the hard palate and soft palate. The posterior surface of maxilla is also there. So there would be posterior superior alveolar branches which will pierce the posterior surface of maxilla and enter into the maxillary air sinus. These branches are going to supply the molar, upper molar teeth. So you have posterior superior alveolar branches which are going to pierce the posterior wall of the maxilla, and they would enter into the maxillary air sinus, and then they are going to supply the upper, posterior superior alveolar artery. So we have talked about nasal branches, we have talked about greater and lesser palatine, and we have talked about posterior superior alveolar branches. Now, the maxillary is going to pass through the infraorbital fissure and enter into the orbit, running on the floor of the orbital, on the floor of the orbit. In the orbit, it is going to give rise to zygomaticotemporal and zygomaticofacial branches. The zygomaticotemporal is going to come out from the zygomaticotemporal foramen, and zygomaticofacial is going to come out from the zygomaticofacial foramen, supplying the prominence of the cheek and the lateral side of the orbit, the skin over the orbit. The zygomaticotemporal is the nerve which is going to communicate with the lacrimal nerve. So in the orbit, it is going to give rise to zygomaticofacial and zygomaticotemporal nerves. Zygomaticofacial is going to supply the skin over the prominence of the cheek. The zygomaticotemporal nerve is going to supply the skin over the side of the orbit. The zygomaticotemporal nerve is going to join with the lacrimal nerve and supply the lacrimal gland also. Everybody is clear with us? Okay. Yes.
About the posterior alveolar.
Yes.
What is going to, like, the branch is going to come from the palatine or?
From the maxillary itself. So
after it enters?
No, before it enters. So before it enters into the orbit, it is going to give branches to the greater and lesser palatine. It gives nasal branches to the nose. It gives posterior superior alveolar nerve which pierces the posterior surface of maxilla and enter into the maxillary air sinus and supply the upper molar teeth. Then it enters into the orbit. In the orbit, it is giving zygomaticotemporal and zygomaticofacial. Zygomaticofacial is supplying the skin over the prominence of the cheek. Zygomaticotemporal is supplying the skin over the side of the orbit. Zygomaticotemporal, because it's a lateral branch, it gives a branch which joins the lacrimal nerve. And this is the nerve which is carrying the parasympathetic supply to the lacrimal gland. Okay? So it is coming from facial through the greater petrosal, reaching the pterygopalatine ganglion, then traveling with the maxillary, entering into the orbit through zygomaticotemporal to lacrimal and lacrimal to the lacrimal gland. So you can see how much hitchhiking it is doing. It is coming from facial through greater petrosal, greater petrosal is joining the pterygopalatine ganglion. Pterygopalatine ganglion is attached with the maxillary. Maxillary is getting into the orbit, or in the orbit it is giving zygomaticotemporal joining the lacrimal supplying the lacrimal gland. Okay, so we are in the orbit. The maxillary nerve is running in the orbit. It has given the zygomaticotemporal and facial. It's also running on the floor of the orbit. Here it is going to give middle superior alveolar and anterior superior alveolar branches which are going to pierce the floor of the orbit, enter into the maxillary air sinus, which you can see here. Middle and anterior superior alveolar nerves which will pierce the floor of the orbit, enter into the maxillary air sinus, supply the upper teeth. Here, then it is going to exit out from the inferior orbital foramen, and as it exits out from the inferior orbital foramen, it is going to supply a branch which is called the superior labial nasal branch, and a branch to the lower eyelid. So a branch to lower eyelid, nasal branch to the side of the nose, and superior labial branch which supplies the upper lip. So the infraorbital nerve which comes out, it's going to give a palpebral branch to the lower eyelid. It is going to give a nasal branch to the nose, the side of the nose, and it is going to give a superior labial branch to the upper lip. Clear? So maxillary nerve again starts from the trigeminal ganglion, passes through foramen rotundum, enters into the pterygopalatine fossa. Then it passes through the inferior orbital fissure into the orbit, runs on the floor of the orbit, exits out through the infraorbital foramen over the cheek bone. Okay, clear? Now, in the middle cranial fossa, it doesn't give any branch. In the pterygopalatine fossa, it's going to give the nasal branches, which goes into the nose. It is going to give greater and lesser palatine branches, which are going to go to the palate. It might give pharyngeal branches, which go to the pharynx also. And it is going to give posterior superior alveolar branches, which will pierce the posterior surface of the maxilla, enter into the maxillary air sinus, and supply the upper molar teeth. Then it is going to enter into the floor of the orbit through the infraorbital fissure. And here, once it is in the orbit, it is going to give zygomaticotemporal and zygomaticofacial branches, which will supply the skin on the lateral side of the orbit and the skin over the cheek. And then it is going to give rise in the floor of the orbit, the middle superior alveolar and the anterior superior alveolar, which will supply the upper teeth. And it would exit out as the infraorbital nerve, which gives three branches: labial, palpebral, and superior labial, nasal, and palpebral branches. So palpebral branch will supply the lower eyelid, nasal branch will supply the lateral side of the nose, and superior labial will supply the upper lip. Now if we see this is the foramen rotundum, and once it comes through the foramen rotundum, it enters into the pterygopalatine fossa. This is the infraorbital fissure. So through the infraorbital fissure, it is going to enter into the orbit, runs on the floor of the orbit, and then comes out from the infraorbital foramen, giving palpebral, nasal, and labial branches. You can see this is the maxillary nerve in the pterygopalatine fossa, and it is giving this posterior superior alveolar branches on the posterior surface of maxilla. Can you see this? They are entering on the posterior surface of maxilla to supply the molar teeth. This is the running of the maxillary nerve on the floor of the orbit, where it is going to give anterior and the middle superior alveolar branches. So these are the middle and anterior superior alveolar branches, which are given on the floor of the orbit. You have greater and lesser palatine branches, which are going to supply the hard and the soft palate. You have the nasal branches coming from the sphenopalatine foramen to enter into the nose. So the lateral and the medial part of the nose, posterior part of the nose. The anterior part of the nose, you know it is supplied by anterior femoral nerve. So the greater palatine nerve, once it arises from the maxillary, it runs on the hard palate and it moves forward to the incisive foramen. And from incisive foramen it goes into the nose, supplying the septal part of the anterior part of the nose as a nasopalatine nerve. So greater palatine coming out from the maxillary, reaches the hard palate, runs forward, reaches the incisive foramen, moves upwards to supply the anterior part of the septum of the nose. So this is the nasopalatine nerve. These are the zygomaticotemporal and zygomaticofacial nerves which are given in the orbit. Okay, so we have done the ophthalmic and maxillary division. We are doing the mandibular division of trigeminal. The mandibular division of trigeminal, as I said earlier, it's a mixed nerve because it has sensory and motor component. We already told you that the motor rootlet of the trigeminal does not enter the trigeminal ganglion. It just passes below the trigeminal ganglion, and as the mandibular division is coming out from the trigeminal ganglion, it is going to join it. And once the mandibular division, the motor and the sensory rootlets of the two parts of the mandibular nerve join in the middle cranial fossa, they are going to exit out from foramen ovale and they would enter into a space which we called as infratemporal fossa. Now in the infratemporal fossa, the mandibular division of trigeminal nerve is going to divide into two divisions, an anterior division and a posterior division. You should remember that the anterior division of the mandibular division of trigeminal has one sensory nerve, which is the buccal, and the rest of them are motor. So all the muscles of mastication, masseteric nerve, deep temporal nerve, which is going to supply the temporalis muscle, the pterygoid, the nerve to lateral pterygoid and nerve to medial pterygoid are going to supply the lateral and medial pterygoid. So these are the branches of the anterior division. There is one sensory nerve which is buccal, and there are four motor nerves which are going to supply the muscles of mastication. So masseteric nerve, deep temporal nerve, nerve to lateral pterygoid and nerve to medial pterygoid. These are the four muscular branches and one sensory nerve. The branches which are coming out from the posterior division are all sensory, except part of one sensory nerve also has a motor branch. So the three main sensory nerves which come out from the posterior division of the mandibular are inferior alveolar, lingual and auriculotemporal. But inferior alveolar also give a muscular branch to a muscle at the floor of your oral cavity, which is the mylohyoid muscle. So it gives a nerve to mylohyoid, which is a branch of inferior alveolar nerve. So it only gives sensory branches, lingual, inferior alveolar and auriculotemporal, but the inferior alveolar also give a muscular branch to the muscle here in the floor of the oral cavity, which is the mylohyoid muscle. So it is called the nerve to mylohyoid. So we have talked about anterior division and posterior division of the mandibular nerve. The main trunk of the mandibular nerve, as it comes out into the infratemporal fossa before it divides into anterior and posterior division, gives branches to muscles of the soft palate, which are called tensor villi palatini and the tensor tympani muscle. So tensor villi palatini muscles are going to be given branches from the main trunk of the mandibular nerve, and then it divides into anterior and posterior divisions. So if you look at it, it's a mixed nerve. It has a sensory and motor branches. It lodges the mandibular ganglion, which is a branch which is functionally part of the facial nerve, and it also lodges the otic ganglion, which is functionally part of the ninth cranial nerve. The submandibular ganglion is attached with the lingual nerve, which is a branch of the mandibular division, and the otic ganglion is hanging with the auriculotemporal nerve, which is also the branch of the posterior division of mandibular nerve. The sensory functions include supplying the lower lip, skin of the mandible, chin, mandibular teeth and gum, anterior two-thirds of the tongue, general sensation through the lingual, and anterior two-thirds of the tongue getting taste sensations because the branch of the facial nerve is coming in, which is called the chorda tympani, and this chorda tympani joins the lingual nerve. And that's how the anterior two-thirds of the taste sensations are coming from the anterior two-thirds of the tongue, passing through the lingual to the chorda tympani to the facial. So chorda tympani is a branch of facial which also comes into the infratemporal fossa. We'll talk about it in a minute when we talk about the facial nerve, how it is going to join the lingual nerve, and from the lingual nerve the taste sensations as well as the parasympathetic supply to the submandibular ganglion is also supplied through the chorda tympani to the submandibular ganglion. Motor functions, muscles of mastication, masseter, temporalis, medial pterygoid, lateral pterygoid, and the mylohyoid and the anterior belly of digastric, they are also supplied by the mandibular division of trigeminal. We also have tensor muscles, tensor tympani and the tensor villi palatini. They are supplied from the main trunk of the mandibular division of trigeminal. This is a muscle of the soft palate, and this muscle goes into the ear, and it is important in terms of making the eardrum more tense. So tensor tympani is the muscle which is going towards the ear, the middle ear, where it is going to tense the eardrum, while the tensor villi palatini is a muscle of the soft palate. The trigeminal nerve, the mandibular division, carries proprioceptive information from the muscles of mastication to the brainstem to apply the force of bite when you are chewing the food. This is a more very descriptive type of diagram. If you see the sensory one is shown in yellow. So this is basically the sensory part of the mandibular division of trigeminal. It's coming out from the foramen ovale, and you can see that it is supplying the anterior two-thirds of the tongue. It is supplying the lower teeth. So this is the lingual nerve, this is the inferior alveolar nerve, and this is the auriculotemporal nerve, which is going to supply the ear, the parotid gland. So this is basically the auriculotemporal nerve. So these are the three major sensory branches of the mandibular nerve. While you can see the motor shown in red, which supply tensor tympani, tensor villi palatini, all the muscles of mastication, as well as the anterior belly of digastric and the mylohyoid muscles. So these are the motor branches of the mandibular division of trigeminal. The blue thing which you are seeing is the parasympathetic supply. So one is from the ninth cranial nerve, which passes from through the lesser petrosal nerve into the infratemporal fossa and joining the auriculotemporal, joining the aortic ganglion, and then postganglionic branches are passing through the auriculotemporal to the parotid gland. While you see this blue one is the branch of the facial, which is the chorda tympani. It enters into the infratemporal fossa, joins the lingual nerve, and through the lingual nerve it is supplying the submandibular ganglion as well as the taste sensations from the anterior two-thirds of the tongue. So chorda tympani has a dual function. It is taking the taste sensations for the facial, and it is also supplying the parasympathetic preganglionic fibers through the lingual to the submandibular ganglion. If we look at this diagram, the mandibular division, you can see this is the anterior division of the mandibular nerve, and it is supplying the muscles of mastication. You can see the deep temporal branches. You can see the buccal branch, which supply the skin over the inside of the buccal cavity which you have. So this is the buccal branch, and this is the muscles of mastication. You can see all of them. This is all coming out from the anterior division. So this is the anterior division. This is the posterior division of the mandibular division. And posterior division is giving this branch which is called the lingual. This is the inferior alveolar, and this one is the auriculotemporal nerve. You can see a nerve coming out here which is joining the lingual. Can you make out this nerve?
Yes.
Which is joining at an acute angle with the lingual. This is the chorda tympani. So chorda tympani is joining the lingual to give the parasympathetic supply to the submandibular ganglion and also the taste sensation from the anterior two-thirds of the tongue. This is the inferior alveolar nerve which is going to enter into the inferior alveolar foramen in the mandible and supply the lower teeth, and then will exit out as the mental nerve. Before it enters into the inferior alveolar foramen, it is going to give this branch which is called the nerve to mylohyoid, and this nerve to mylohyoid is supplying the mylohyoid muscle and the anterior belly of the digastric muscles. We see it again, we can make out here, this is the anterior division which is supplying the muscles of mastication, which include deep temporal, mesenteric nerve, nerve to lateral pterygoid, nerve to medial pterygoid. And it is also giving this buccal branch which is going to supply the mucous membrane inside the buccal cavity. Then you can see the three branches of the posterior division. This one is the lingual, and this one is the inferior alveolar. Sorry. This one is the inferior alveolar, and this one is the auriculotemporal branch. Inferior alveolar is entering into the mandible through the inferior alveolar foramen, supplying all the lower teeth. And this one is the lingual, the nerve to mylohyoid, which is going to supply the mylohyoid muscle. It will not enter into the inferior alveolar foramen. It will supply the mylohyoid muscle and the anterior belly of digastric. So you can see the foramen ovale here in the skull. This is the foramen ovale from the, from the inferior angle or from the downward view. So this is the infratemporal fossa. So you can see foramen ovale here. You can see this is the mandibular nerve coming out. This is the anterior division. This is the posterior division. You have the auriculotemporal here. This is the lingual, and this is the inferior alveolar nerve. You can make out the motor branches here. These are all the motor branches which are supplying the muscles of mastication. These are the branches to the tensor villi palatini and the tensor tympani. This is the buccal branch which is coming from the anterior division. This is the auriculotemporal nerve which is going towards the ear. It is going to supply the ear, the external ear, the temple as well as the parotid gland. This is the lingual and this is the inferior alveolar. This you should not miss. These two nerves you would see on all the infratemporal fossa dissections. So you need to see the nerve which is in front is the lingual, the one at the back is the inferior alveolar nerve. This is the nerve to mylohyoid before it enters into the infraalveolar foramen. Nerve to mylohyoid is going to supply the anterior belly of digastric as well as the mylohyoid muscle. You can see this is the inferior alveolar nerve running into the mandible, supplying all the lower teeth. This is the chorda tympani joining the lingual. You can see this is the lingual nerve going all the way to the tongue. So it is not entering into the mandible. It is running all the way to the tongue. It is going to supply the anterior two-thirds of the tongue. So now we have some questions. Okay. So with all the information which you have about the trigeminal nerve. So the first question is, a 40-year-old male came with shooting pain on the right cheek and the right side of the nose. Which one of the following nerves will be involved in this case? So it cannot, this is basically trigeminal neuralgia. So trigeminal neuralgia, you have electrifying pain within the distribution of the divisions of the trigeminal nerve. Now all these nerves are branches of the trigeminal. The supraorbital is a branch of the ophthalmic division. The infraorbital is a branch of maxillary. The supratrochlear is basically a branch of the ophthalmic. Buccal is a branch of mandibular division of trigeminal, especially the anterior division of the mandibular division. And mental is also the nerve which exits out after the inferior alveolar. This is also the branch of mandibular division. So what we are saying, the distribution is the right cheek and the right side of the nose. So the upper lip and the right side of the nose are supplied by infraorbital nerve, branches of the infraorbital nerve. So the true answer here is infraorbital nerve. Yes, somebody has a question? Yes, right side of the nose and the right cheek. Buccal is inside. This area is all the upper lip, and this cheek area is all supplied by infraorbital. There are three branches of infraorbital, we told: supralabial, lateral nasal, and palpebral branch. Okay? Next question. A 15-year-old boy came to the ophthalmic clinic after being hit by a sharp object in the right eye. The boy has severe pain in the right eye. Ophthalmic examination showed a corneal abrasion. Which one of the following nerves is responsible for the pain in the right eye in this patient? A is oculomotor, B is optic, C is short ciliary, D is long ciliary, E is frontal. Which one? D is long ciliary. So long ciliary is a branch of the nasociliary, and this is the branch which is going to supply the eyeball. Oculomotor is motor to the extraocular muscle. Optic nerve is for vision. Short ciliary is parasympathetic. It's coming from the ciliary ganglion. It is not sensory. Frontal nerve is the main nerve which is going to divide into supraorbital and supratrochlear, so it will supply the upper eyelid and the forehead and the frontal ear sinus. Okay, a 40-year-old man came with rash involving the nerve distribution shown below. Which nerves are involved here? Supratrochlear and supraorbital. So the branches of the frontal nerve, which are the branches of ophthalmic division. This is actually what? Shingles involving or herpes zoster involving the trigeminal nerve distribution. Okay? Okay. 25-year-old with chronic maxillary sinusitis came with right upper molar pain. Which division of trigeminal is involved in this pain? Which nerve is involved? So this is maxillary and posterior superior alveolar nerve, which is just before the maxillary enters into the orbit. It is going to give posterior superior alveolar, which pierces the posterior surface of maxilla to supply the upper molar teeth. A dentist is planning to extract the lower molar teeth of a patient. Dentist needs to anesthetize which nerve and where? Okay, you need to anesthetize inferior alveolar before it enters into the inferior alveolar foramen. So this is the place which you are going to see. This is the coronoid notch. So coronoid notch is basically gives an elevation in the inner part of the mouth. And then you can see this ridge, which is the pterygomandibular raphe. So this is the point where you are going to pass your needle in and give an inferior alveolar block to anesthetize the lower teeth. A 15-year-old boy develops mumps. He has extreme pain in opening the mouth. Which nerve is causing this pain? Auriculotemporal nerve. Because auriculotemporal nerve is a branch of the mandibular division which supplies the capsule of the mandible. Yes?
Isn't the capsule supplied by greater auricular?
No. No. No.
Auriculotemporal?
Auriculotemporal.
Isn't that should be parasympathetic?
No. Auriculotemporal is sensory. The parasympathetic is coming from the lesser petrosal nerve. Okay? Okay, next we are coming to the facial nerve. Facial nerve is a mixed nerve, motor, sensory and parasympathetic. Motor to the muscles of facial expression, which supply the muscles on the face. Besides that, it supplies stapedius, posterior pelli of digastric and stylohyoid muscle. It is sensory for taste sensation from the anterior 2/3 of the tongue and some sensory skin sensation around the ear. Now, the most important thing is to understand the course of the facial nerve, because it is a little bit tricky. What happens that you know that the facial nerve comes out at the junction of pons and medulla. Then as it comes out, it is going to enter into the ear through the internal acoustic meatus. You have external acoustic meatus. In the posterior cranial fossa, you have the internal acoustic meatus. So the facial nerve is going to come out as a motor and sensory rootlet, and it is entering into the internal acoustic meatus. And a nerve is exiting out from the internal acoustic meatus, which is the vestibulocochlear nerve. So you have the motor rootlet of the facial, sensory rootlet of the facial, and below that you have the vestibulocochlear nerve. These are the three nerves which are there in the internal acoustic meatus. So motor rootlet of facial, sensory rootlet of facial, and the vestibulocochlear nerve. The sensory rootlet of the facial is also called nervus intermedius. Why we call it nervus intermedius? Because it is between the facial and the vestibulocochlear. So you have motor rootlet, sensory rootlet, and the vestibulocochlear nerve in the internal acoustic meatus. So once the facial nerve enters into the ear after passing through the internal acoustic meatus, it reaches the promontory. Do you know the promontory? In the middle ear, there are three parts of the ear. External ear, which is a canal up to the eardrum. Then you have the middle ear, and then you have the internal ear. In the middle ear, because the cochlea has these turns, it forms a bulging in the middle ear, which is called the promontory. So as the facial nerve enters into the middle ear, it is above the promontory. So it is running like this. So it's come out from at the junction of pons and medulla, enters into the internal acoustic meatus. It is moving over the promontory. Once it reaches the promontory, it will turn backwards. So it was going forwards, then it is going to turn backwards. So as it is going to turn backwards, it is going to form a genu or form a turn. So as it is going to turn backwards, it will move towards the posterior wall of the middle ear. Once it reaches the posterior wall of the middle ear, it is going to exit out as a straight canal, facial canal, through the stylomastoid foramen. Once it comes out from the stylomastoid foramen, there is parotid gland in front of it. It enters into the parotid gland, and then it divides into its 5 terminal branches. So again the course. It enters into the internal acoustic meatus, passes over the promontory and makes a turn, forming a genu. As it turns, it moves towards the posterior wall of the middle ear, and then once it reaches the posterior wall of the middle ear, it turns downward longitudinally in the facial canal to exit out from the stylomastoid foramen. Does everybody understand this? Clear? Now, in the posterior cranial fossa, it does not give any branches. When it forms a turn, which is the genu, it is going to give a branch which is called the greater petrosal nerve, which is a parasympathetic nerve, which passes through the petrous temporal bone and enters into in the middle cranial fossa, runs over the foramen lacerum, and reaches the pterygopalatine fossa after passing through the pterygoid canal. We will talk about this later on. But from the genu, it is giving one nerve, which is the greater petrosal nerve, which is a parasympathetic nerve supplying the pterygopalatine ganglion. Before it enters into the facial canal and runs downward, it gives a branch which is called the nerve to stapedius, and this nerve to stapedius supplies a muscle which is called stapedius muscle, which stops the movement of the stapes. So it stops the movement of stapes. So if you're hearing loud sound, it's a dampener. Okay? So the action of the muscle is to dampen the sound. So before it enters the facial canal, it is going to give one nerve, which is called the nerve to stapedius, supplying the stapedius muscle. Within the facial canal, before it exits out through the stylomastoid foramen, it gives a reverse branch which goes back into the middle ear, and that is called the cauda tympani. And this chorda tympani passes over the eardrum and pierces the petrotympanic fissure to enter the infratemporal fossa. And in the infratemporal fossa, it joins the lingual. So, 3 branches. Greater petrosal, when it turns, make a genu. Over the promontory, it is going to give greater petrosal. Before entering the facial canal, it gives nerve to stapedius, which supplies the stapedius muscle. In the facial canal, it gives a reverse branch which goes back into the middle ear. It's called chorda tympani. Once it exits out from the stylomastoid foramen, it gives a branch to the posterior belly of digastric, and then it enters into the parotid gland, dividing into 5 branches. The 5 branches within the parotid gland are temporal, zygomatic, buccal, marginal, mandibular, and cervical. So these are the branches of the facial nerve. Yes, go ahead.
After it gets out of the stylomastoid foramen,
it gives a branch to the posterior belly of digastric before it enters.
what about the stylohyoid?
Yes, and stylohyoid. So posterior belly of digastric and stylohyoid, it gives before it enters into the parotid gland. Once it enters in the parotid gland, it is going to give branches to 5 branches, which are temporal, zygomatic, buccal, marginal, mandibular, and cervical. These are the 5 branches of the facial when it enters into the parotid gland. So now let's see. We will talk about these questions later on. So parasympathetic supply of the facial is to the lacrimal gland via the pterygopalatine ganglion, submandibular and sublingual gland via submandibular ganglion. Damage or disease to the facial nerve is called the Bell's palsy in one eye and may develop hyperacusis. So now let's see the branches of the facial nerve. So facial nerve is going to enter through the internal acoustic meatus into the ear. In the ear, it is going to give this parasympathetic nerve, which is the greater petrosal nerve. And in the ear, it is going to give this nerve to stapedius. When it is running in the facial canal, it is going to give rise to this chorda tympani, which will run back into the ear, pass over the eardrum, and exit out from the petrotympanic fissure to join the lingual nerve, which is going to supply the submandibular ganglion and also take the taste sensation from the anterior 2/3 of the tongue. Once it exits out from the stylomastoid foramen, it gives branches to the posterior belly of digastric and the stylohyoid muscle, and then it is going to supply the 5 branches: temporal, zygomatic, buccal, marginal, mandibular, and cervical. If we look at this, you can see this is the facial nerve entering into the internal acoustic meatus. So you can see this is the internal acoustic meatus. Then it is making a turn. Can you make out this turn? This is the genu. Now it is going to move back towards the posterior wall. As it will reach the posterior wall, it will run downwards. So this is again showing you internal acoustic meatus reaching the petrous temporal front part. It is going to make a turn, which is known as the genu. Yes.
As it makes the gene, it will make the geniculate ganglion.
Yes, the geniculate ganglion from where the greater petrosal nerve is going to arise. So greater petrosal is coming out from here, going into the middle cranial fossa. So it is making a turn and then going back towards the posterior wall. As it moves back towards the posterior wall, you can see it is moving back towards the posterior wall, and then it exits out through the stylomastoid foramen. Now it is moving back, and then it is going to come out from the stylomastoid foramen. This is the nerve to stapedius, which is going to supply the muscle which is called the stapedius muscle. As it is moving towards the back, it is giving the nerve to stapedius. You can see from the genu, the greater petrosal nerve is going to come out. And this is the chorda tympani, which comes out within the facial canals, moves back, and then comes out from the petrotympanic fissure into the infratemporal fossa. So this rod-like iron-type thing which you are seeing is the nerve which is going to come out within the facial canal, goes back and comes over the eardrum, and then comes out through the petrotympanic fissure into the infratemporal fossa. This is parotid gland, and you can see the 5 branches: temporal, zygomatic, buccal, marginal, mandibular, and cervical. So the zygomatic branch is the one which is going to supply the orbicularis oculi muscle. So if it gets paralyzed, then you would not be able to close the eye. These are the branches which are supplying the orbicularis oris. So let's go back to some of the questions here for the facial nerve. Let's see if you can answer them. Okay, a 30-year-old with the base of skull fracture involving the right tympanic plate of the temporal bone. He subsequently lost taste sensation on the right anterior 2/3 of the tongue. Which nerve is involved and where? It's the chorda tympani which is involved. Where it is involved? It is the petrotympanic fissure through which it exits out. It's in the base of the skull. So you have the nerve, which is the chorda tympani. It's a base of skull fracture. It exits out from the petrotympanic fissure into the infratemporal fossa. So where it is basically damage, it is damage in the petrotympanic fissure. And which nerve is involved? This is chorda tympani. An 80-year-old underwent cochlear implant in the right ear for hearing loss. During the procedure, surgeon accidentally injured a nerve. The patient following the surgery had dryness of the right eye and dryness of the right side of the nose. It is the greater petrosal nerve, because sometimes when you are putting up the cochlear implant, you go through the middle cranial fossa approach. If you are using a middle cranial fossa approach, you can damage the geniculate ganglion from where the greater petrosal nerve rises, and this is the greater petrosal nerve, and where it is the middle ear, the geniculate ganglion from where the greater petrosal nerve rises. A 24-year-old man was unable to close his right eye following a parotid gland surgery. Which nerve is involved in this case? Temporal branch of facial nerve or zygomatic branch. It's a zygomatic branch of the facial nerve which supplies the upper eyelid. Okay? Temporal branch is supplying the occipitofrontalis. The orbicularis oculi is supplied by the zygomatic branch, and zygomatic branch is important in closing the eye. A 50-year-old diabetic, after viral illness, developed sudden drooping of the right angle of the mouth. He was unable to close his eye. No wrinkle develops on the right side of forehead on frowning. He is suffering from which condition? So this is Bell's palsy. And Bell's palsy usually happens in diabetics after viral illnesses. So even if you don't know anything, you can come out with this, that this is Bell's palsy. A 24-year-old developed hyperacusis in the right eye after prolonged chronic suppurative otitis media. Which nerve is involved? The nerve is stapedius, and this muscle which is involved here is the stapedius muscle, which is going to get paralyzed. So the first question is, there's a 40-year-old man came with shooting pain on the right cheek and the right side of the nose. Which one of the following nerves will be involved in this case? So there is a shooting pain on the right cheek and right side of the nose, and one of the nerves which are listed there is involved is supraorbital hairs, infraorbital, supratrochlear, buccals, and retinal. Yes. What do you want? Infraorbital. Infraorbital. The answer is correct. We will see which nerve it's a branch of. It's a branch of the maxillary division of trigeminal. We'll talk about it in a minute. Then there is a question. A 15-year-old boy came to the ophthalmic clinic after being hit by a sharp object in the right eye. The boy has severe pain in the right eye. Ophthalmic examination showed a corneal abrasion. Which one of the following nerves is responsible for the pain in the right eye in this patient? Oculomotor, optic, short ciliary, long ciliary, retinal. So we'll go through the branches and then you would understand which nerve is responsible. So we will build up this information as we go on. So there is a 40-year-old male came with a rash involving the nerve distribution shown below. Which nerves are involved here? So which branches of ophthalmic are involved here? Supraorbital and supratrochlear. And what is this disease? Okay, so we'll talk about that too. A 25-year-old male with chronic maxillary sinusitis came with the right upper molar pain. Which division of trigeminal is involved in this pain? Which nerve is involved? We will talk about that too. A dentist is planning to extract the lower molar tooth of a patient. The dentist needs to anesthetize which nerve and where? Inferior alveolar. But what are the landmarks where he is going to find the inferior alveolar and how he is going to anesthetize? A 15-year-old boy develops mumps. He has extreme pain in opening the mouth. Which nerve is causing the pain?